Hello, Vonda. Thank you so much for talking with us today. It's really lovely to have you here. Vonda, we wanted to ask you a couple of questions today. And the first question that we'd love to ask you is in relation to closing the gap. And I'd love to hear from you, what does closing the gap mean in relation to Torres Strait Islanders, and also in general, with all of your wonderful experience, what does it mean in general?
Thank you, Fee. Closing the gap is something that we are very much known about Indigenous peoples' inequities and I guess the life expectancy gap between Indigenous and non-Indigenous Australians. So when we look at close the gap, particularly in the Torres Strait, we have a greater need for emphasis on how we can work with respective governments in relation to closing that gap. Unfortunately, in the Torres Strait, I mean, this is a Commonwealth policy setting that was driven nationally, but how does it apply? How does it apply, particularly when it goes out to the more remoter parts of, we are in Queensland, remoter parts of Queensland, and how can it still make a difference to close the gap and increase the life expectancy of our people, the most vulnerable and the most needed in the areas that are the most remotest in Queensland. So it means really a collective approach, both with Indigenous peoples, as First Nations people, to be able to work together to see where we can address or we can work towards making it more accountable to the services that we really need to cater for the needs of our people. So that's where we sit in relation to CTG. And yes, unfortunately, we are in a predicament that the life expectancy gap for us here in the Torres Strait, we do have still a huge gap. The realities are we have a 21-year life expectancy gap as compared to other parts of Queensland. And that is really concerning for people like us that are in the space of trying to move that into a greater life expectancy for our people.
Exactly. Look, it sounds to me like an extraordinary situation, but one of the most incredible things that I've learned from talking to you is about the organisation that you have founded, and also you're the chair of, which is called Torres Health. And you seem to be doing some extraordinary things. But the thing that I'm really interested in is how you have used good governance as a foundation to support you in this being a real solution. So take us through that journey and tell us about how the good governance that you've used interlays with the success of it.
Yes, I've been fortunate that I've worked with a very experienced board to establish Torres Health. It's formed in 2017, and the essence was to try to make a difference in our people's well-being, particularly focusing on our young people. So if we're going to make generational changes, we have to start with our young people. And a lot of our diseases are preventable. So how do we work in that space of preventative health? So I, as chair and founder of Torres Health, in establishing this organisation, the essence was to start with the good foundation. And the good foundation is the governance in which we instill and how we do business, and balancing that with the accountabilities of not only our community from a cultural point of view, but also from the expectations of our funding body. So how do we do that constructively and make sure that it's successful and it gets greater outcomes?
I think that sounds terrific, and I'm interested in that notion of governance and accountability, not just for the organisation, for the funding, but that notion of accountability to your family and to your community. Can you talk a little bit about that? Because what I've learned from you is governance is nothing new. It's been something you've been doing for thousands of years. But it's how do you marry those two responsibilities together?
Yes, and I think from the professional experience that I've had extensively in the public service, both regionally, nationally, internationally, I've always walked between the two governance systems that we have, as in the cultural governance and the mainstream governance requirements for our respective funding that we receive. So cultural governance, obviously we come from small communities, we have vibrant, active culture that is distinct. And we have two First Nations people in Australia. Torres Islanders are very distinct with seafaring people. So how do we ensure that what we deliver is going to meet the requirements and the needs of our people based on those cultural protocols and practices? So that way it has greater buy-in, and plus we are accountable to that because it's instilled in the way we do business. It's part and parcel of how we were brought up by our families, by our grandparents. And it's a lot of it's based on accountability, respect, how you treat other people, how do you engage, how do you make sure that you can still walk in community and have that respect and rapport. So that's how we, that's to embed respecting our culture is one of our values. How do we do that as an organisation? How do we work together with community? How do we make sure that they're informed? How do we make sure that they are co-designing these programs? Because it's their program. Yeah.
Co-designing is something you alluded to before. So I love what you were saying, Vonda, in that you're co-designing with the next generation because that's before they get sick or before they get the chronic diseases.
Most definitely.
Which
and it's
must
the
be
young people that we are targeting, the audience that we have, their buy-in, they're empowering, they're driving it. So it's not something that's from Canberra or Brisbane. And then we're trying to take that off the shelf and slot it into a cultural context or an island context and make it work. It's never going to work. We've tried that. We've seen that fail. So how do we do that differently, leading that from the people, that the consumers in which we are delivering services for? So we've shifted our model to reflect that. But at the same time, accountability, yes, we tick all the boxes. Best practice, we look at it from the universal best practice in primary health care down to the national standards, down to us. We look at the big picture and then we filter it down to still maintain that good governance. But it is definitely, I say, more sustainable way of practicing. Otherwise, we're delivering something that's just not going to meet the needs and address the gaps. And at the same time, Close the Gap is about enhancing what we already have. I mean, it's a multi-billion-dollar policy-driven initiative by the Commonwealth. But the dollars that's expended to this portfolio don't necessarily reach us here in the outskirts. So how do we make sure we map that out and see what dollars are being invested so then we can make sure we get better bang for buck, because it's all about outcomes. And how do we work with those partners like the hospital and health services, like the other AMSs that are in the sector, to ensure that it does reach the people that most needs it.
It's absolutely wonderful. It's such a good model, and of course, working with the primary health networks, and I gather that they are very supportive of what you're doing, and you work with them for that primary care approach, which is what they are delivering all the time. So, speaking of outcomes, have you got any stories or any examples of what you're doing through your Torres Health organisation?
We were successful when we started to get the support of the Regional Primary Health Network for the establishment, the confidence that we had a good model to reach out. And it was the first community control health organisation based in the Torres Strait, delivering for Torres Strait people. So in that establishment phase, we used to make sure we embed those good governance practices and clinical governance framework, which we've just completed. That's been a huge milestone in such quite a short period of time, and we have been commented that we have done an incredible job in a very short, in a span of 2 years. And having that in place, having a model that can be replicated and showcased in other parts of Queensland has also been a great achievement by a relatively small organisation. So all in that is how do we make sure that we continue that? How do we make sure that those programs, and we have some success programs that are championed. So we have champions, young people championing our programs and delivering it. And a lot of that on a voluntary basis.
Is it
So
voluntary?
we have such an uptake of our people that they are willing to do that on a voluntary basis. So we have fitness programs for certain age groups. There's women's programs that are run, as well as CrossFit, depending on your fitness level. We also have programs for young mothers. We have programs for young people who are young kids that are disengaged from school. And so they enter into our boxing program, and then they build their confidence, and they excel. And we've seen that and they're in national competitions already, and they're getting back into their schoolwork, feeling confident about themselves. So we work very closely with the schools to be able to work with those kids that may be disengaged. So that, and all the other stakeholders that we have worked with is really eagerly engaging with us, because they can see that there's things happening, positive things happening for our kids.
I love it, Vonda. It feels to me that your approach to closing the gap is really sensible. It's upstream, and it's using your First Nation community members to look after your community members, and it feels like you're getting real traction. And can I just commend you on getting your clinical governance model and frameworks right? Because we work across health across Australia, and that's difficult. So
Yes.
well done. That's huge.
Yeah, we just launched our community care last week. So we're really in a better space now to look at the opportunities of getting on board a GP that will be specifically there to, through our programs, engage with our young people. It's, opportunistic screening and going to the school. So there's lots of possibilities once we've got this model in place, which is really has been a huge step forward for the organisation.
It's a very good model, and it's really great credit to you. And thank you so much for telling us about it today. And it's really good to understand what closing the gap means to you, and a fabulous model of what you have in place to address it from your own community support. That's
I think
really good.
the important message, Fee,
Yes.
is ownership, community ownership and empowerment. That is the only way we can really close the gap. It's not policy driven down, it's community driven up. And Indigenous people have a key role in leading in that field. We know our people, we know what the needs are. We see it every day, we experience it every day. How do we be champions to be able to do that? Well, we need the investment and confidence of the government to be able to allow us to do that, and to ensure that the funding gets to where it needs to go and be delivered in a way that's culturally safe and appropriate.
Yes, that's so good. Vonda, thank you so much. It's been lovely talking with you, and it would be lovely one day if we could come and see your incredible organisation.
Most definitely, I welcome you to visit. Thank you.
Thank you. Thank you.